Thank you. Thank you very much for giving me the opportunity to participate in this wonderful course. I've brought two quick cases on early experience of using faricimab in PCV. So you've heard from Bas talk about the SALWIN study, which is treatment-naive PCV, currently recruiting for faricimab, following similar to a Tenaya Lucerne kind of protocol. There's one of the patients from my site that we recruited. These are the baseline images. You can see pretty typical of a PCV, and there is actually activity from the network as well. And so far, the patient has been dosed 2 times, but already you can see very, very impressive results. You can see, just to orientate you, in the middle column are the baseline images, the color showing you the bulge and the fluid, and the narrow PED and the ring inside it, typical features of PCV. And on the right are the baseline, month 1 and month 2. So following month 1, you can already see a lot of resolution of the fluid and the FREM. And at month 2, after the second injection, further improvement. What was particularly impressive was that the PED, which is harboring the polyp, basically the ring inside it, is progressively getting smaller, and we can see the content is getting more and more hyper-reflective. So next month, this patient is due for the scheduled ICG, so I'm looking forward to seeing the results. But this one is very impressive. Moving on to another faricimab case. This is a switch case, a 68-year-old patient who you can see the bulge is here and the corresponding double layer sign, the narrow PED, the ring inside it, the multilobular PED, just to repeat what has been said, and with some more cases. On the FA, is an occult type leakage. On the ICG, you can see the bulge over here. This flash-based ICG is not very clear, not as good as the CSLO. This case started treatment back in 2019, so basically has been on treatment for 3-4 years. And you can see that there is actually initial response to a aflibercept. The SRF reduced, but that PED was there throughout the whole 4 years. The patient has about 20 injections. So we could control the fluid. As Adrian's mentioned, you can inactivate these fluid, but if we suspect that the polyp hasn't gone away, every time we kind of taper off the retreatment of the injection, we worry about it coming back. And in this case, every time we went up to 10 weeks, that SRF will be back, and that PED just sits there for 3 years. So by the time we got faricimab last year, I switched the patient over to faricimab. You can see that at 8 weeks after the first injection, there's no SRF. That PED was there, so I'm not okay, not bad, but I could do better. So after the second injection, we started to extend this patient to 10 weeks. Again, no SRF still. That PED was there. And then after another injection. So nowadays, I believe more and more towards the need for loading. I see these effects accumulating. And this is what impresses me most in treating a PCV case, not so much the fluid, but the sub-RP fluid. That PED just flattened after 4 years, hasn't done that, and maintained. And on top of that, we now can extend this patient as a poster boy case to 16 weeks, and very beautiful anatomical results. Of course, these are selected cases. I wish everyone was like that, but of course, that's not all cases. I'll just be very clear. Thank you.
Thank you very much. Thank you, Jamie. And our next speaker is Professor Yu